Okay, now I'm going to start, Bapak Ibu sekalian, because now it's 3:34. So let me start. So welcome to the Indonesia Project's COVID-19 webinar series. My name is Arianto Patunru, and I'm hosting this with Nur Kemala Mulyani and Baskara Adiwena. We acknowledge and celebrate the first Australians and pay our respect to the elders past and present. We are grateful for the support from the Australian National University and the Australian Department of Foreign Affairs and Trade. As usual, we will have Q&A session after the talks, but if you want, you can write your question anytime on the Q&A box, not on the chat box. We'll attend to them in the Q&A session. Please also kindly fill a little polling when it appears on your screen. We need this to improve our series. Today's webinar is the last in our COVID-19 webinar series this year. We started this on 25th of March, and today is the 25th seminar. I would like to thank all those who have kindly participated during the last 10 months. These are the speakers, the chairs, discussants, and of course, all of you, dear attendants. Let me also acknowledge that none of this is possible without the skillful hands of Nuke and Dodi. So thank you, Nuke and Dodi. Now, today's event is a special one, not only because it concludes our 2020 round, but it also presents not one or two or three, but 6 distinguished guests. The theme is Indonesia and COVID-19, an end-of-year reflection and the way forward. Let me thank Professor Budy Resosudarmo from ANU and Dr Titik Anas from Universitas Padjadjaran, who will have a chat about government response to COVID-19 pandemic in Indonesia. And then Dr. Liza Munira from ANU and Professor Tikki Pangestu from National University of Singapore, who will discuss about public health issue. And last but not least, Professor Hal Hill, ANU, and Dr. Chatib Basri, Dede, from Universitas Indonesia, who will reflect on economic aspects. Now we'll start with the first topic, government response. So let me invite Professor Resosudarmo to kick it off. Silakan, Mas Budy.
Yes, thank you, Pak Aco, for the opportunity, and thank you, Bu Titik, for your willingness to participate in this session. Let me first introduce Bu Titik Anas. She graduated from NU. She received her both master and PhD degrees from our program, the Uncoordinated Department of Economics at the NU. And she did her undergraduate with the Faculty of Economic and Business at the University of Indonesia. We're certainly very proud to having Bu Titik playing a significant role in developing policies in Indonesia regarding to COVID-19. So I guess the first question that I would like to ask Bu Titik is that could you explain in general what have been done in terms of fiscal policy that Indonesia has produced, particularly to counter the downforce of this pandemic toward the economy? And then after that, I will follow up with several other questions. But if others would like to send their question to chat, I will also read their question. Bu Titik, could you summarize what have been happening? And then could you also please give a little bit about what will be in the future, which is next year?
Okay. Thank you, Pak Budy. Thank you, Aco, for the invitation. I'm very happy to share any information and also would like to listen to the distinguished professors at the ANU, where I learned many things, including social life, how to mitigate, to balance life between my family and study. Thank you for the question, Mas Budy. The COVID-19 is unprecedented, so we didn't really anticipate it's coming in February or January. But then when it comes, first, of course, with the hit in China, and then it affected our supply chain. But then at that time, we have not yet declared that we are already also affected with the virus. So at the early stage, the response in terms of fiscal is facilitating the business people, especially those that is affected by the COVID. Then when the COVID-19 hit, then we have to adjust the fiscal policy so that it can respond immediately to the crisis it is affecting. It's not only health crisis that we were facing at that time, but also economic crisis, the social, and also the impact or the risk to our financial system. So the first thing first is that to have a legal basis. So the government introduced the government regulation for emergency situation. It's called Perpu in Indonesia. Then the Perpu is legalized as a law by the parliament. With this law, the government can, one, adjusting its fiscal policy, particularly the budget, not only at the central government, but also at the region. Yeah. So, and the adjustment is not only one. We adjust the budget twice. So with this adjustment, we focus the budget on at least three main issues. One is handling the COVID itself. So a lot of fund is allocated to health crisis prevention. So to handle the COVID. The second one is to protect or to support our people, especially the vulnerable, the bottom 40% of the population in terms of income. The third one is to support the business communities, particularly the support is for the micro, small, and medium firms. With that, with the legal foundation, then several other implementing regulations also need to establish to legalize any actions that the government has to undertake in order to handle the impact of the COVID-19. So for the COVID, I mean, for the preventing health impact of the COVID, the government has allocated like almost 100 trillion. And for the social safety net, the government allocated like 234 trillion. So it's quite a lot of fund allocated to that. For our micro and small and medium enterprises, the government allocated like 115 trillion, so that the impact of the COVID, first, that the Ministry of Health and the COVID-19 task force has no issue with the funding. The second one is that the bottom 40% still have purchasing power to be able to support their minimum basic needs. And for our MSMEs, they are able to say, for example, if they have a current loan, they are waived from short-term repayment. This is provided by the bank, so this is a collaboration actually. And then The second one is that the government pay their interest rate, their interest, so that they don't have to pay interest on their loan. The government also provided MSMEs and also all the affected companies with the tax relief. And the government also provided later during the course support for the workers, because as you probably know that the government also has this prakerja. It is on-demand application, so that those that is unemployed can receive benefit. One is for the skilling, reskilling, and second for the social protection support. Maybe that's for the introduction, Pak Budy.
Thank you very much, Bu Titi. So I have to ask these things. This is your opinion, yeah? Your opinion. If we can get back, like today is early February, when the COVID just started with Indonesia. In your opinion, what you would like to suggest different than what have been the government do? It doesn't have to be something that, but just in term, it could be in term of the type of policy, it could be in term of the speed of the implementation, in term of those things. What you would like to, what you think that you would like to suggest different than what the current government policy?
Well, if we turn back the clock, I think there are a few things that we can improve, Mas Budy. But during the course of this action, I think we also learn from the way we handle the early phase of this pandemic by improving our response, yeah, including, for example, how we do better in tracing, for example, how we increase the space or the capacity for our treatment, not only treatment for those who are in serious illness, but also for the self quarantine. So if you are aware that we have Wisma Atlet, so it's a few buildings that were fortunately were empty after the games, and we utilize that for self quarantine provided by the government. So we learn by the course during the course of the action how to handle it better. So we in the government, we have this monitoring and evaluation task force or unit, Pak Budy, so that we frequently monitor what has been carried out and how we better or we can improve the response.
So this is, you are suggesting that probably that you would like to suggest better or react faster is in handling the health issue much faster than what is happening. It seems that is the way that you respond. Could you, since you're talking about this fiscal related to managing the health, I don't want to occupy the topic that Liza and Pak Tikki would like to take, but two things. The big debate was whether we have to have a stricter social distancing and limitation of movement. So do you think that the current policy is already about just right? The second issue that has been debated is that why the fiscal spending on the health was an issue. Is there a way actually to be better to resolve those issues?
Sorry, Mas Budy, the first question, what was it?
The first question is the debate that this is related to better handle the health is whether we should have a much stricter social distancing policy and stricter movement of people. Yeah.
Okay.
So it is like lockdown basically, or the current strategy is actually just about the one that we could do. And second is that the issue on the stimulus on health that was in the media. So they said that it's a bit slower than comparing to other.
Yeah, thank you, Mas Budy. So on the first issue, I think the government is always faced by a dilemma and diversity of our region, our population. So to have that kind of balance is often challenging. So for example, some are highly affected by the virus need to be contained. And the containment is, of course, some part is done by the local government and some part is the authority of the central government. But you see that coordination between the central government and the local government is very important. And also probably you also see that our people is also have their own thinking. For example, some people don't believe in that COVID-19 is dangerous or highly contagious, but some people really obedient, you know, so they follow the government instruction, wear mask, keep a distance, don't go near the crowds, for example. But some others are just, they have you see, they have events that attract a lot of people to come, for example. So it's kind of a challenging situation, I guess, that the government is facing. But throughout the time, this coordination is always been attended. I mean, paid attention to, and also the communication with the people is also being improved, so that the perception of our people as this similar, that we have to be very careful with this virus, and we have to do this 3M, we call it in Indonesia. Menjaga jarak, memakai masker, menghindari kerumunan. Dan
okay, we have,
tangan yang.
Thank you. We have 5 more minutes. I would like to ask 2 more questions. One is actually from Yogi Vidyatama. He would like to know how much COVID budget that has been able to disseminate by currently, and whether it is required to be decentralized according to similar to other budgets. So he would like to ask, one is that how much is the total or the percentage of fiscal stimulus of COVID that has been spent, and how much is actually has been decentralized to other government. Now, my final question is that could you say a little bit to us, what will the government do next year what are some continuation of fiscal policy in managing the COVID, and is there any new strategy? So if you could provide us some light about what will happen next year, that would be great. Thank you.
Terima kasih, Mas Budi. So on the first question from Yogi, so up to the 25th of November, the budget allocated to COVID-19 has been disbursed 62%. So it's like 431 trillion. And it is disbursed through government and also local government. So, for example, the budget on Dana Desa, it's disbursed by the village, and for the we call there's some part of the funding is being decentralized, including health, education. As you know, that the school has received this quota, internet quota, provided by the government, not only a school but also university, the teachers and the lecturers. And also the government so regional loan. It is not directly from the government account, but through the government special vehicle PT SME. And the response to this local government loan is quite very for loan, but the demand for that is higher. So it means that the local government has the need to fill the gap between their spending and their fiscal capacity. Oh, on Mas Budi question, yeah, next year. I think well, the government already submitted the budget to the parliament, and it's already approved. So we have the 2021 budget. But of course, with this pandemic, we still have to watch closely what happened. And one of the things that is different from this year is that we have to allocate quite a significant amount of funding to secure vaccine. The good news is that some of the vaccine will arrive the end of this year, and but it has to wait for the BPOM license to actually use for vaccination early next year. And also the government, of course, depends on the health. The government also used the momentum to reform the economy. So a lot of funding next year allocated for IT improvement, education improvement, health improvement, and on top of the continuous support for social protection and COVID-19 response in terms of health funding. Mungkin itu, Mas Budi.
Yeah, thank you, Bu Titi. Thank you for those informative information. Our time is already finished, and so on behalf of the Indonesia Project, I would like to thank you for your kindness and your willingness to participate. And it's good that we talk about vaccine, so then it's good transition for the next session. I would give this session to Liza and Tikki to talk about the issue of health during this COVID-19 pandemic. Liza?
Thank you, Pak Budy and Ibu Titik. So I believe Professor Tikki Pangestu needs no introduction, but maybe just a few words on why I think we have the best person in the room or Zoom to chat and reflect about public health in Indonesia, particularly looking at COVID-19 pandemic this past year and ways forward. Just a few words on Pak Tikki. Professor Tikki Pangestu is an expert in immunology, microbiology. He's in fact an INU alumni. He's an academic scholar who spent many years at the World Health Organization as director of Department of Research Policy and Cooperation. And now he's back in academia, currently a visiting professor at the School of Medicine at the National University of Singapore, and was previously with the Lee Kuan Yew School of Public Policy. Terima kasih, Pak Tikki Pang. Selamat pagi. Just to kick off our conversation, I have a few questions in regard to public health. So first question is, we know it's a global pandemic. It's affecting all regions in the world, but one might be able to argue that Asia, given the fact that in Asia it holds over 50% of the population, yet when we look at the cases, it's about 20%. So one would argue that Asian countries are doing comparably better than the rest of the world. I wonder what your thoughts are on that, and are there any lessons for Indonesia?
Thank you very much, Titi, and hello everyone. I feel a little bit out of place in this webinar because all of you are economists. So maybe probably would have been better to get the other Pangestu rather than me to be involved in this. But at any rate, Liza has asked me to sort of focus on issues from the public health perspective. So to answer your question, why have Asian countries done better compared to the rest of the world? I think Pak Budy has already highlighted one of the key factors here, and that is the speed of reaction. Okay, many Asian countries reacted very quickly, very strongly to the pandemic as soon as it began. So I think that was the crucial underlying difference. However, I think there are three other factors that has made Asian countries stand out. And this was highlighted by Vivian Balakrishnan, Singapore Minister for Foreign Affairs. The first one is good governance. And Titi already mentioned the importance of good coordination between central and local and provincial governance. That sort of unity of purpose, trying to achieve a common goal, coupled with political will and commitment, and importantly, free from political interference. So that's number one, good governance. Second one, social capital. Once again, Titi alluded to this. Populations which are obedient, which follow government instructions without any protest, without alluding to personal freedoms. It's my right to choose whether I want to wear a mask, which is the big problem in many countries in the West. Okay, so social capital, populations which place the good of the community ahead of self-interest. Second factor, social capital. And overall, that sort of means trust in government, which I think, generally speaking, Asian countries have more trust in government compared to the so-called Western democracies. Okay, that's just my personal view. And the third factor, obviously, is quality healthcare. The capacity of the health system to take care of those who are severely ill, to give treatment where appropriate, to also do preventive strategies. So those are the three things: good governance, social capital, and quality healthcare. There are other issues as well. Like, I think most Asian countries, I just mentioned one, most Asian countries tend to have younger populations compared to, say, those in Western Europe. Okay, so as we know, it is the older people, people like me, over 65 years of age, who are more vulnerable. There are also sort of other cultural factors. If you recall, the Thais, for example, when they meet, they don't go and hug and kiss the way Europeans do. Okay, the Japanese, they bow. Okay, so there are sort of cultural issues here as well. So back to you, Liza.
Thank you, Pak Tikki. And I'd also, I guess, also mention to those watching in that we invite you to have your questions asked through Q&A or the other means that's already mentioned in the chat. So, Pak Tikki, from what you've explained, would you suppose Indonesia's done enough and in managing this pandemic? We see numbers, you know, especially in the past few days, especially it's been rising. And do you think maybe from that, are there any further measures or actions that can be done, particularly to reduce and hopefully maybe eliminate community transmission in Indonesia?
Yes, I think obviously, I think the government has tried its very best to manage the pandemic. But as you mentioned, in the past week, it is still going on. You know, cases are reaching record highs, or record sort of positivity rates, which is very worrying because it indicates community transmission is still going on. But despite all of that, I think in terms of reinforcing, you know, further actions, I think once again, Titi has already mentioned this. The first is to continue testing and tracing and you know, sort of quarantining those clusters that are going to increase community transmission. It's well known that most outbreaks in many countries is related to these so-called super spreader events. Okay, so your testing has to be right there. And perhaps what is missing here is, once again, the lack of a uniform national standard in the way in which those cases are being reported, you know, from the level of the districts to the province to the central government. I think having a national standard of reporting is very, very important in terms of, going back to what I said before, quickly reacting when you see a super spreader or a hotspot of clusters. So that's the first thing in terms of further actions, you know, strengthen your testing, tracing, and quarantine. Secondly, and Titi already mentioned this, is stricter social distancing, okay? Banning large gatherings. Now, as Titi said, that's a real dilemma for various reasons. And I think Indonesia has faced a particular problem in enforcing social distancing. So that's number two. Thirdly, something that probably has not been mentioned, the importance of community support, community awareness, education. Titi already mentioned this, but I'm sort of referring not just to communities, but actually to neighborhoods. You know, get down to the level of the RT and the RW, you know, community leaders at the household level to, you know, strengthen, reinforce the message. As Titi said, this is not something trivial. This is something very, very dangerous. Okay, and people are still not really aware of that. So that's community awareness communication, number three. The fourth one, which it's once again is a political dilemma. I think that opening Indonesia to domestic tourism has probably been not such a good idea. Okay, now obviously there are economic considerations here, but if you're going to open to domestic tourism, make sure you have the surveillance, the monitoring, the testing in place to ensure that movement of people within Indonesia, you know, everybody goes to Bali, for example, is monitored closely for the possibility that there are going to be super spreaders coming from Jakarta going to Bali, or vice versa. Okay, so that's the fourth one. Monitor domestic tourism. And finally, obviously, better coordination between central, local, and provincial governments. So those are just some of the actions I think that we can do better in the future. Thank you.
Thank you, Patiki. If we now bridge on a little bit to universal health coverage, we know Indonesia's invested a lot in expanding the BPJS and also revitalizing puskesmases and all this. Would you suppose, this would somehow touch on, good governance, social capital, trying to go into quality healthcare? Has all these investments somewhat helped support the Indonesian government or Indonesia in general in managing the pandemic?
The answer is yes and no. Okay, but let me preface by saying that investment in universal healthcare is actually based on having a robust, resilient, and sustainable healthcare system, okay, which is sort of backed by policies, strategies, resources, and programs, and which is going to be critical generally, which is one of the worst things that can happen. And I want to cite the example of Rwanda in Africa, okay, as an example of a country that has successfully invested in universal healthcare. Now, Rwanda so far has less than 6,000 cases of COVID. You compare that with Pennsylvania in the US, which is about the same size, population, land area, etc. Pennsylvania has 360,000 cases. That's 60 times more than Rwanda. So what did Rwanda do in terms of its healthcare system that can account for that difference? First, solid primary care rather than investing in hospitals, for example. Secondly, care which is accessible and affordable. Thirdly, they protected their existing systems. In other words, they did not allow the system to be completely diverted to COVID. They maintained to make sure that other conditions are not neglected. And finally, good coordination among the stakeholders, the government, the community, the private sector, private physicians, for example, and obviously NGOs and international organizations. So for Indonesia, yes, we know BPJS, there is a commitment from the Jokowi government to provide universal health care. But, to be very frank, as we all know, there are still quite a lot of problems regarding the implementation of BPJS. And just to highlight a few of these, obviously the big problem that we all know is not enough money, okay? There's been a shortfall of about $2 billion US. And it has been a shortfall for the last 5-6 years since it started. And this is partly related to the fact that 75% of our workers are in the informal sector. So it's difficult to collect tax revenue to support BPJS. So that's the first problem, not enough money. Secondly, legacy issues. As we know, before BPJS, Indonesia has many different health insurance schemes. One for the civil servants, one for the people in the armed forces, one for the private sector, etc., etc. So coordinating that has been a problem. Third, as we all know, there are continuing issues with fraud and corruption within the system. The next problem is low quality of drugs and also counterfeit drugs, obat palsu, yeah, and that's a big problem sometimes within BPJS. Overprescription, giving medicines when it is not really justified. And finally, and this is an economic issue, underutilization of generics. it's this perception of people. I want the patented drugs. I don't want the generic drugs because it is not as good. So sorry, that's a long answer to your question. But once again, I think to underscore the fact that UHC is absolutely the fundamental requirement for managing the pandemic. And Titi already mentioned that the government will allocate more budget. So I hope some of that budget will be spent on strengthening BPJS. Absolutely crucial.
Thank you, Pak Tikki. I mean, that's absolutely brilliant. And it does sound like we're in a tightrope in a sense that, investments are being done, progress is there, and then, this pandemic happened. But as the theme, year-end, end-of-year reflection and moving forward, what would your prescription, Pak Tikki, be on, what to do first, perhaps, or what to prioritize first, one or two, or maybe just one thing that can be, prioritized for the next year?
Yeah, given the current situation, without going into too much detail, I would definitely say that the topmost priority is to strengthen your surveillance. I mean, Indonesian system for surveillance and monitoring. Once again, going back to testing, having a uniform national standard of reporting, being able to trace where the hotspots are, and finally implementing quarantine, social distancing, and enforcing those measurements. It's no use having your restrictions and laws if you are not going to enforce it. So surveillance, monitoring, enforcement, that would be top of my list.
Thank you. And I'm hoping, I'm taking notes, and I'm sure the government, if they're tuning in, is also taking notes. My final question, but then we'll have a number of other questions from the forum. My final question is, and this is probably the $1 million or maybe $1 billion question. We know that there's this race in developing the vaccine. I imagine you're following this quite closely, Pak Tikki. When that happens, if that happens, will the vaccine end the pandemic? And what do you see as possible scenarios for Indonesia?
Yes, thank you, Lisa. Of course, everyone's talking about vaccines at the moment. My view of this is definitely, not just Indonesia, but any country. Vaccines definitely has the potential to help end the pandemic. By itself, it will not end the pandemic. So that's the most important point. But before a vaccine, and I'm not going to say which vaccine is better than the other, but before any vaccine can help to end the pandemic, we need to take care of several factors in terms of, how are you going to deliver the vaccine so that it helps you end the pandemic. The first one is the logistics of delivery, okay? And that goes back to my point about having strong healthcare system. Many of these vaccines, for example, require very cold storage. In one case, minus 80 degrees centigrade. In another case, minus 20 degrees centigrade. In the third case, much better, refrigerator, 4 degrees centigrade. Now, even in Western countries, okay, requiring storage at minus 80 is almost an impossible task, let alone for a country like Indonesia. Okay, so that's the first one, the logistic of delivery. Secondly, very important, who decides who gets the vaccine? Okay, that's a question of equity. That's a question of human rights. Who makes those decisions? All right, that's going to be another dilemma, economic, political, social, whatever you want to call it. Third, who pays for it? Who can afford it? Are you going to charge people for it? Is government going to give a budget? I hope Titi indicated that it will. Fine, but it still then goes back to who gets the priority to get it. So that's the third one. Who pays? And as we know, there is a COVAX facility led by WHO, the World Bank, and Gavi that's trying to improve access to developing countries. So hopefully that will help. That third issue of who pays for it. The fourth one, very important. Will the people accept the vaccine, okay, you can't assume that they will, okay? As we know, in Indonesia, in many countries in Asia, especially in the Western countries, there's a very strong anti-vaccine movement that basically says, oh, vaccines are dangerous, I'm not going to accept any vaccine, okay? That's a very difficult challenge, okay, which actually merits a webinar all by itself. So that's number 4, vaccine acceptance. Don't assume that people will accept. The 5th that I've already mentioned, once you introduce a vaccine, you need a very strong monitoring and surveillance system, okay? Yes, there has been fantastic progress in the development of this vaccine, but remember, these studies are not yet complete, okay? And although, yes, most of these vaccines have been tested in 30, 40,000 clinical trial participants, what happens when you introduce the vaccines into millions of people, okay? You don't yet know whether there will be reactions that you didn't see in the smaller trials. So you need a very strong monitoring surveillance system once you introduce the vaccine into the population. Very important. And my final point here, the most important point perhaps, is do not think of the vaccine as a magic bullet that will end the pandemic. We have to be very sure that we maintain those proven public health measures at the same time as we introduce the vaccine. Continue wearing masks, continue social distancing, continue quarantine, continue the banning of large gatherings, okay? Dr. Robert Dayfield, the director of the CDC in USA, gave a news conference about 2 months ago, where in front of the camera, he waved a mask and he said, this is actually much better than a COVID vaccine. Okay, so the point there is don't neglect those proven public health measures together with the vaccine. Thank you, Liza.
Thank you, Tikki. I'm certainly learning a lot. I'll be reading out some questions that we have in the Q&A. So one question is, Indonesia has lost many doctors due to COVID-19. This may reduce resource and capability to deal with this virus in the long term. What does the government need to do to anticipate lack of doctors and medical staff? What can we learn to anticipate the same disease in the future in terms of developing more bottom-up approach?
Yeah, I mean, thank you for that question. And that is, in fact, a very tragic sort of event that happened in Indonesia. Not just in Indonesia, I can cite the situation, the same situation in the Philippines. I lost a very good friend of a leading Filipino pediatrician who actually died of COVID. So the issue here is obviously the protection of frontline healthcare workers. And this is once again going back to what Pak Budy said, speed of reaction. The first people that you have to protect whenever something like this happens are your frontline health workers, your doctors, your nurses, the people who are even in the community, in the clinics, looking after potential cases. And you know, you have to react quickly, and importantly, you have to have in readiness the stocks of PPE, they call it personal protective equipment. You have to have, you know, abundant supplies of gowns, of face shields, of masks, of gloves, etc., etc. So, you know, it goes back to sort of, in a way, in the economic sense, self-sufficiency. You know, if you like, to have a ready stockpile of PPE, of this equipment. So the minute something like that happens, you're not scrambling, you're not trying to import gloves from Malaysia or from China, or, you know, sort of you don't have enough supply to protect your healthcare workers. So I think, you know, it's a question of preparedness, readiness, and maybe also improving your domestic capacity to produce these critical supplies to protect your health workers.
Thank you. Another question is by Ade Prastiani. So, citizens' trust the national government and national health system is crucial for pandemic management. However, there is still major confusion in the wider society about whether the cost of their testing, if they are in contact with or at risk of COVID, will be covered by the government, further reducing the trust. Meanwhile, middle of this year, the decision was made to increase JKN premiums by twofold for the non-TBIs. How do you see these phenomena combined together with pandemic governance? I think it's the fact that you can have free testing if and only if you have previous contact with the COVID cases is one point, and then the fact that JKN premiums are being increased might contradict with having these benefits.
Yeah, I think that's quite sort of a difficult question in terms of, you know, providing sort of solutions. But I think underlying that whole issue of confusion is once again what Titi and Budy already highlighted, the importance of good communications on the part of the government. Okay, and that obviously extends not just to communication about the risks of COVID, but as the question alluded to, it extends also to sort of nitty-gritty questions about what is covered by insurance. You know, what kind of tests are available? What do those tests actually tell you? Are there differences between the way provincial governments, local governments do the testing? I may be wrong, but I don't think there is a uniform national standard, which makes it difficult to educate and communicate to the public about this. But that's a critical priority: good communication, clear communication about, you know, what is covered, what is not covered. And the whole issue is obviously complicated by fake news. Okay, social media is spreading a lot of misinformation, rumors, propaganda, hoax, you know, false information basically. So that is part of the confusion. Okay, and if I look at it generally, okay, if you compare the social media that's spreading false news compared to government using social media to educate the people, there's a lot more fake news out there than there is good information. Okay, so that's another big sort of communication challenge, which has to be overcome. It's difficult, but that's the reality. You know, people listen to these kind of rumors. You know, every day I'm getting, you know, all these sort of false news videos, spreading all this false information through the various WhatsApp groups. So that's circulating out there. So that's the other big.
Try to read two questions. I think this is maybe something you could clarify. One is, and then the rest of the questions will leave to the end of the session, after the three sessions. So first one is, doesn't COVID spread much more slowly in low population density areas? So won't more agricultural or rural countries perform better than highly advanced or urbanized countries? This, I think, is on that first question we asked. The second one is by Kevin Tigana. Pak Tikki, when you said the government is trying its best, is the government's best enough? We still have one of the lowest test rate, minimal enforcement, and most importantly, glorification of recovery rates. In your perspective, what can be improved?
Yeah. The first question, yes, absolutely true. In many of the countries in Asia, obviously, this is I'm talking about examples like Vietnam, Cambodia, Laos, perhaps even Thailand. A lot of the population are still working more in rural areas, in agriculture. So they're working outdoors rather than in big cities, in air-conditioned buildings where everybody gathers together. So yes, that's another factor. More people are working outdoors. That's true. Except, of course, in big cities like Jakarta, Manila, Bangkok. But look at Thailand. Bangkok has controlled very well once again because of a very good system of testing and tracing. So yes, that's the answer to the first question. More agriculture, more people working outdoors. The second question, yes, I mean I'm not going to go down the path to sort of criticize the government. I think the government is doing its very best, and as Titi said, I think there is a commitment on the health side to provide more budget. But once again, as the question highlighted, there is still the issue of limited testing. There is still the challenge. Okay, so enforcement of social distancing, quarantine, movement during Lebaran, for example, it's very difficult. It's as Titi mentioned, that's a real dilemma that probably has to be tackled at the level of communities. Involve your religious leaders, your kepala RT, your Pak Lurah, to educate and communicate to the public. But no, absolutely, I'm convinced the government is doing its very best, and hopefully there will be more investments in not just in health, not just in vaccines, but in maintaining social stability. That's the dilemma. Thank you.
Thank you so much, Pak Tikki. I think that's all the time we have to discuss this. I'm certainly learning so much. So now over to Pak Hal Hill and Pak Chatib Basri, who will be discussing on the economy. Thank you.
Thanks very much, Lisa, and welcome everybody to this part of this really interesting webinar. And let me just in passing congratulate the organisers of this wonderful webinar series all year, to Acho and Nuka and Dodi in particular. It's been such a disruptive year, and these webinars have sort of brought us together or kept us together in a wonderful way. So thank you to them as well. And thank you to the previous sessions, to Titik and Tikki and to Lisa and Budy. I've learned a lot myself as well. So good afternoon, good evening, good morning from Canberra. It's my pleasure to introduce the next distinguished speaker in conversation with, and that is Professor Chatib Basri. Dede, hello, good afternoon to you, and thank you very much for joining us. Can you hear me okay?
Yes.
Good.
Thanks for having me.
I should just say that Dede actually knows quite a bit about Canberra as well. He spent quite a bit of his time in Canberra. In fact, even in the adjoining city of Queanbeyan, he even knows that. He can tell us a story or two about the real people in Queanbeyan, I think, can't you, Dede? And it was Dede who first had the quip, the quip that Canberra is a plan without a city and Jakarta is a city without a plan. I use that quip often, thank you, Dede. So Dede completed his PhD here, a fine dissertation on Indonesian trade policy in 2001. Everyone, I think, will know since that time he's had a remarkable career as an academic at the University of Indonesia, in government, including as Minister of Finance, and in the world of business. And more generally and very importantly as a public intellectual. So it's a great pleasure to have you with us, Dede, and thank you again for your time with us. So I'm going to just raise some general issues. Please feel free to comment on anything else that you think is important, Dede, and the audience also will come in with questions, I think. The first question I'd like to lead off with, Dede, is in spite of the many challenges, the Indonesian economy hasn't actually done that badly this year. That is, it looks like now that the economy is going to contract by about 1.5–2% of GDP. That's a lot less than many rich countries, and it's also quite a lot less than countries like India, Philippines, Thailand, the sort of countries that you might compare Indonesia with. I wonder if you'd like to give us your take on why it is that, in spite of course, the many serious problems, things haven't turned out quite as badly as might have been expected, including compared to these comparators.
Well, first of all, I would like to thanks ANU for organizing this webinar, and then thanks for having me. So let me try to answer your question, Hal. To be honest with you, we probably need more time to understand about it. Yeah, because the data is still too early to conclude. Yeah, but my response to your question is perhaps about 3 factors that have an impact on Indonesia. The first one, as Titik mentioned, about the response from the government by providing the fiscal stimulus, etc. And I think maybe I can, if you don't mind, I will not give a presentation today, but if you can look at in this chart, hopefully you can see this slide, you know.
Yes, thanks, we can see it. Thank you.
The impact of various income group based on the profession. This data, I took it from, this is based on the data from Bank Mandiri. You can see that the sector, 100 is the pre-COVID situation, the normal one. The one who get affected by this was really the informal sector. But people with the fixed salary, etc., you know, not much really affected. So it was very clear that the one who get affected by this pandemic is mostly the middle and lower income group. And then if you look at, this is the consumer spending, it is very interesting. Again, 100 is the normal one, the normal situation. The high income group, they only spend about 70% of their spending, normal spending during the pandemic. But if you look at the poor people, they spend about 84%. So the poor people, they spend money because they don't have savings. The high income group, they save more. Yeah, so looking at this situation, and I would say that response from the government, like the fiscal policy, will be very crucial, especially by providing this cash transfer. That's the first answer. The second one, it is very interesting. Of course, this is too early to conclude now, but this is very interesting to look at this chart, this data. Of course, this definition is very, you know, is very relaxed in terms of how do we define lockdown here. Maybe lockdown is a very, in terms of this very strict lockdown like Melbourne, like some cities in Australia, and non-lockdown is like spectrum, like a partial lockdown, no lockdown at all. If you look at this chart, it is very interesting. The only country that performed relatively well with the lockdown is only Vietnam and China. Yeah, and why they are able to do it? Because they could curb the pandemic within short period of time. But the rest, if you look at the country with the partial lockdown, they are doing relatively well compared to the lockdown one. Yeah, so if we make a conclusion from this, we can say that maybe the decision to lock down the economy definitely will have an impact. But if you look at this chart, this is the correlation between economic growth and infected cases or death cases per million people. We can see the negative correlation here. We probably need to do a more rigorous econometrics, but we probably have to wait for the data. It is negative correlation. So it shows that countries who are not able to address the pandemic will experience a negative growth. And that's explained the position of Vietnam, of China, because they are. So my concern is at this stage, while it is true that Indonesia was able to sort of like mitigate the pandemic, but if this pandemic prolong, then maybe we'll have a different conclusion. Yeah, next year, because it depends whether the country will be able to address the pandemic. To me, addressing the pandemic should be the top priority. And the third factor is maybe the openness, because country like Indonesia, our share export to GDP is around 30%, whereas country like Vietnam, you know, more than 200%, and that's explained. When China start to recover, when the global economy start to recover, country like China, like Vietnam, you know, recover much faster than a country like Indonesia. So perhaps that probably those three possible, explanation why Indonesia are doing relatively well.
Mm. Thanks, Dede. That's really interesting. I'd like to come back to those points if we have time later on. Incidentally, in passing, you've just illustrated a very important point, which is there are going to be hundreds and maybe thousands of PhD dissertation topics from this very tough year. I wonder, on the economic response, Titik covered some of this, and very interestingly, could we dig down a little bit more on the Indonesian government's sort of macroeconomic response? And just thinking about it in a bit more detail, so and I'd be interested in your reaction and comments. So initially, there was a financial market hit, capital flight, the rupiah fell quite sharply, stress in the financial markets, and Indonesia moved very quickly, I think, in that monetary stabilization role, along with other central banks. Then came the fiscal stimulus, which has been, as Titik mentioned, it's more complicated in a sense, the monetary stabilization, because you've got to get the money out somehow or decide are you going to do tax cuts, are you going to spend more? And so that happened, but a bit more slowly. I'd like to draw you out a bit on that as well. And then there've been the broader issues of how the money was spent. Could you tell us a little bit about that sort of sequence of events from the sort of, the monetary stabilization through to the fiscal stimulus and your general comments on it and lessons learned from it?
Again, not a tough question.
Let me try to. I apologize. It's such a
answer your question, because this is going to be another PhD thesis to answer this. But let me try to answer to your question by sort of like identifying the source of problem. Yeah, we had a problem from the both demand shock and supply shock. In the very short term, the issue is really weak demand, which is clearly because the aggregate demand collapsed, because the collapse of income, as I show in my slides earlier, and then this is confirmed also by the loan to deposit ratio is declining because not many companies would like to borrow money from banks because the demand is not there. So under this kind of situation, when the rupiah get hit, there is no way for the Bank Indonesia or monetary policy to respond it by using the interest rate policy. Yeah, because the issue is not on the demand pool or excess demand. The issue is the weak demand. So one way to handle the situation is by lowering the interest rate. It reminds me with the situation in 2008. That's exactly what Bank Indonesia did at that time. So I do believe that this is not unique in Indonesia. Every central bank all over the world responded to the situation, even the depreciation of the currency, even by the lowering the interest rate. But I have to be honest with you, how one of the reasons why the stabilization process was relatively easy for many countries, including Indonesia, because every country are doing it the printing money or quantitative easing. And that stabilized the exchange rate, because if you recall, the rupiah hit almost 15,000 in the beginning, but then the Fed introduced the QE, Bank Negara Malaysia introduced QE, Australia, Singapore, all over the world, they introduced QE, and as a result, then the rupiah gets strengthened, until today. So partially, the stabilization on the monetary policy was also helped by the external policy in other countries, and then capital inflow flying into the emerging market. That's on the monetary policy. The good thing is the impact on the supply side probably will appear probably not this year. Maybe next year or the year after. So we don't need to worry so much at this moment with the aggregate supply. That is why the financing from the burden sharing of Bank Indonesia by debt monetization in the very short period of time, in the limited time frame, is justifiable. Not much impact on the inflation because we are at a Keynesian range now. If you push the money supply, and not much impact on the inflation. But if we continue doing it, probably 2 or 3 years from now, then there will be an impact of this inflation. That's on the monetary policy. What about on the fiscal? I believe that we heard from Titi about all this program, and I would say that the government responded in appropriate manner related to that. And if you look at the government consumption on the third quarter, it posed a positive growth, almost 10%. In the second quarter was negative minus almost 7%. So the fiscal stimulus, worked in the proper manner to turn around the economy, making the recovery path probably will be like in the Swatch shape or the Nike logo brand. But one thing that I would like to discuss in a more detail, if we have time, is if you look at the composition of the spending, as of November 18, so it's about 2 weeks ago, the realization of the spending is still less than 60%. And if you look at the composition, the social assistance already reached about 83%. But if you look at the support for the corporation, 3%, even health is only 30%. So the main driver for this fiscal stimulus is actually come from the cash transfer or the social assistance.
That's the PKH and the Kartu Sembako.
PKH, the Sembako, the BLT, etc. So this is really the main driver for the turnaround in the economic. And that's exactly, my slides, confirm that the biggest problem is the lower middle income group, because they need to get support. But if you look at in other allocation of spending, probably we don't do very well on this. So that is why, in my view, maybe this is the room for the government to improve, or you just become pragmatic. You just focus on the area that government will be able to spend the money in a proper manner relative to other sector. So that's on the fiscal policy. One thing that I would like to share with you is what will be the implication for next year. Because I don't think the private investment will kick in next year. After listening to Pak Tikki regarding the distribution of vaccine. If the pandemic is still there, then the government need to impose the health protocol. If the health protocol is still there, then there is no way the economy will operate 100%, because you need a distancing. And then you cannot, if you cannot achieve the economies of scale, then no incentive for the private sector to invest. It means by 2021, the economy will continue to depend on fiscal, on fiscal policy, on the social assistance. My concern is by 2023, the government should have the budget deficit less than 3%. So you could imagine, if 2021 government still need to expand, maybe continue until 2022, and the tax revenue, the share of tax revenue to GDP is only less than 3%, less than 8%, whereas you have to achieve the fiscal deficit less than 3% by 2023. If the government cut the budget severely in 2023, there will be a fiscal contraction. So this is against my belief, Hal. I was trained to believe with the fiscal discipline, but in my view, now is about time to think it is more important for the fiscal stimulus rather than fiscal discipline until the economy is fully recovered.
That's very interesting. And of course, by then we're getting pretty close to the next presidential elections, aren't we, in 2023? Can I just draw you out a little bit on that fiscal story and ask you to comment on this? It seems to me that although Sri Mulyani the finance minister, has to walk a tightrope, she doesn't want to spook the markets, but she's got to kind of stimulate the economy. And as you say, she's done it pretty successfully. It's true to say, isn't it, that actually Indonesia has had quite a bit of fiscal space to move, because it's the government's been very prudent fiscally since the Asian financial crisis, and before, actually. I mean, debt to GDP 30% or whatever it is currently. Secondly, with the relaxation of the fiscal law, as you mentioned, for the next 2 years. Thirdly, Bank Indonesia willing to step in to the bond market as a primary buyer if necessary, and it's done that. So in a sense, the government does have a bit of room to move for currently, next year, and probably 2022 at least, doesn't it? Do you think that's a reasonable statement?
Yeah, I agree. That is why I'm not too worried. That's why I can, I mentioned to you earlier, I'm a great believer about the fiscal discipline. But at this moment, the theme of the fiscal policy all over the world is do whatever it takes. So probably the government need to be more flexible to make their decision on data dependence, whether they should withdraw the fiscal expansion by 2023, or they just look at the condition. And I can see there is still a room to do it. Don't forget, Hal, in 1999 or the year of 2000, our debt to GDP was around 120%.
Exactly.
Once we imposed the fiscal rules, 2003, when I left the MOF, our debt to GDP was around less than 24%. So it means that we had a capacity to lower the debt to GDP to impose the fiscal discipline. So I'm not too worried so much about this issue.
Yeah, it seems to me Indonesia had a dramatically successful fiscal consolidation over that period. People often forget, and it was at a period when growth was maintained. I mean, not many countries do that as successfully as Indonesia did. Now, on the fiscal deficit and its financing data, the other point which links to that is external finance. You can have domestic finance through borrowings, or you can have international finance. Now, we're in this world which is still a rather unsettled world where it's difficult to get collective action, coordinated action, trust in global institutions. One almost gets the sense that Indonesia has been on its own for a lot of this year. Of course, that's an overstatement. The ADB, World Bank, bilaterals have played a role, but it is striking, isn't it, that Indonesia, in a sense, still can't go to the IMF. The political history is still complicated. The regional safety nets, known as CMIM, haven't been used. So in some ways, Indonesia has been on its own quite a bit, hasn't it? Because those international financial safety nets haven't really kicked in the way you might like them to. Is that an unfair judgment, do you think, or is that too harsh?
I completely agree with you, Hal. Basically, Indonesia and many Asian countries are on their own since the 1998 Asian financial crisis. If you recall, even Singapore, during the global financial crisis to 2008, they didn't go to the IMF. They went to the Fed for the bilateral swap at that time, including Korea, because the issue, exactly what you said, is the stigma of the IMF. And that's exactly what we did in 2013. We avoid IMF and we went for the bilateral swap with China, with Korea, with Japan, Australia, etc. And then secondly, you're talking about CMIM. The main problem with the CMIM, number one, is it is untested. So we don't really know, how to implement this CMIM mechanism, etc. And number two is the quota is relatively small. A country like Indonesia, maximum that we can get probably only 30% of the total quota, 21 maybe, but maximum 6 to 7 billion US dollar, which is pretty small. If you can go to the bilateral currency swap, like I recall during when we had to manage the taper tantrum in 2013, we were able to to mobilize fund for the second line of defense was around 60 billion. So CMIM was relatively, so under that kind of situation, bilateral swap, what will be maybe is not the first best, but would be the best option available. The second one, I think this is about the time for us to think about this regional financial safety net. Unfortunately, we don't have that kind of mechanism. And then that is why about 6 months ago, 5 months ago, with some colleague at the ANU at the ABER, Asian Bureau of Economic Research, we also proposed that ASEAN, the Asian countries, should sit together, including Australia, New Zealand, for example, Minister of Finance, Central Bank Governor, to sit together to address this issue. We were lucky because everyone's, were doing it, this quantitative easing. Otherwise, countries like Indonesia and some Asian countries will be hit very hard by this capital outflow. So I completely agree with you. This is still a homework that we need to solve about the regional financial safety net, and unfortunately, until today, we don't have it. Indonesia was quite lucky because I think it was about 2 weeks ago, the Australian government also announced the support for Indonesian government, and that's exactly, if I recall, when I was a finance minister in 2013 during the taper tantrum. But the pool of fund is limited, so we probably need to find a other source of pool of fund. And I don't think that for the future we can rely on this burden sharing with Bank Indonesia, because it will make a jittery in the market.
That's very interesting. That's another PhD dissertation topic I can see. In a sense, it's the nucleus is ASEAN, originally ASEAN +3, that is the Northeast Asians, China, Korea, Japan, Australia, New Zealand. I was going to say ASEAN +6, but it doesn't look like India is yet in it, but it could become part of it. A really interesting point. I'm conscious of time moving on pretty quickly, Dede. We could talk all day, and I know there are some questions waiting in the chat box. Can I just ask one other general question? And it's something I know it's quite close to your heart. You've written on it. In fact, we've written on it together. Are there any broader implications from the crisis we can see emerging from, if you like, Indonesia's political economy trajectory? That is it changing the dynamics or possible dynamics of Indonesian economic policy making, the way, as we know, other crises have done that? In fact, your PhD dissertation was, in a sense, about that as well. Are we seeing, is it perhaps too early to see anything like that? Crises can sometimes embolden governments. Sometimes they can actually derail governments. Is it possible Indonesia might turn inward because of this anti-globalization sentiments or not? Or will it reinforce the regional architecture, since, as you mentioned, China will probably lead the region out of the crisis? I wonder if any thoughts, it's a very big topic, but have you got any thoughts on the nexus between the crisis and political economy issues?
I wish I could answer your question, Hal, but because the situation is very different now, yeah. But let me share my view related to that, yeah? Because the current situation is very different. Why? On the external sector, there is a strong pushback for globalization. Because one thing that we learn from this pandemic issue, maybe some country will focus on their own, yeah, related to the trade policy. I'm not saying this is good, but this has become the global sort of like the global trend now.
And all this vaccine nationalism, stuff like that, exactly, as well. Yeah.
Exactly. And then some people even called that country with the authoritarian, more effective than democratic. So that kind of situation will push the policymaker in the very difficult situation. Why should I open my economy if other part of the world become protectionist? So that is the factor from the external one. The second one thing that I'm worried about this pandemic is about the post-COVID. Yeah, because the one who can survive from this COVID-19 crisis in the middle and upper class, they are the one who have savings. What about the lower income group? They cannot stay at home. If the government introduced the PSBB, the social distancing, without providing the social protection, they cannot survive. The third one, yeah, digital divide. The one who can survive from this crisis they are the one who can transform themselves into digital technology. But digital technology is very expensive and not, available to all over the country. I can imagine in Papua, in eastern part of Indonesia, it's very difficult. So there is a risk, even though at the macro level probably will recover, but there is a risk of the K-shaped recovery.
Yeah.
Because the middle and upper income group are doing relatively well, but the poorest, the middle lower income group will be in a very difficult situation. Under that kind of situation, I can imagine the policy will tend to be more, quote unquote, more on the social justice, the welfare, etc. If you want to introduce the liberalization, perhaps you will not get the political support. Yeah, so that is why I wish I could answer your question by saying, yes, don't waste the crisis. But I think looking at this current situation now would be not easy to expect that every country will do the economic reform. If you look at the composition in the US now, yeah, look at the composition of people in the Council of Economic Advisors. It's hard for me to conclude that they are the one that who really pro-lenient to the market because it's kind of situation. So we are in the very different world compared to 80s. Yeah, everyone can say that after all, we are all Keynesian at this moment. And then, it will be very difficult to expect that if you're talking about the reform by liberalizing the economy, move toward market is not going to be easy politically.
Yeah, that's very interesting. I mean, thinking about it, the one really interesting difference between this crisis and the Asian financial crisis was that your political system, your polity is much more settled. Whereas, of course, as we know, in 97, 98, it triggered the collapse of the Suharto regime. So in that sense, that's a big plus for Indonesia, I guess, isn't it?
Yeah, I agree with you. So that is why looking at the political ingredient, maybe it's quite different. If you look at the omnibus, if you look at the omnibus, you can see how the reaction from the people, not about the substance, but about the process or the procedure. Yeah, so somehow reflects that the way people look at about this implication for the reform, and I don't know whether the leaders later on are willing to spend their political capital on it. I cannot answer this.
Sure. Yeah, no, thank you. Now, Dede, I think we're just about out of time in our segment. I see quite a few questions in the Q&A box. Can I ask Acho or Nuk, shall I go on with the Q&As to Dede, or do you want to open it up to general Q&A?
You can pick one or two questions, and then I'll continue later on.
Is that okay?
Yeah, sure.
Okay, so one or two questions. That might be quite heroic, but can I just pick a couple that there are several. I'm sorry to the other questions, I can't cover them all, but I do see my good friend Rick Borsel, the author of that wonderful book on the Salim Group. I guess you're in Singapore, Rick. Hi. Let me just quickly, Dede, read out Rick's question. Dede, could you comment on the controversial omnibus law and whether it can help Indonesia get more investment? Even if the COVID situation improves sharply in 2021, Indonesia may struggle to get new investment, unlike Vietnam. That's one question. Dede, if I can just put a couple more on the table, if that's all right with you, Acho, too.
Yeah, sure.
We have the one and only Ross McLeod on song. Ross is saying, guess what, Dede, you probably know the question. He's saying on quantitative easing, quote unquote, the growth in reserve money in Indonesia in the year to October was minus 2.5%. We should focus on what the central bank actually does rather than what people say it's doing. Dede, that question won't come as any surprise to you. So let me see, I've got another question, one more if I may. It's a question from Riandi at ANU. Hi, Riandi. Riandi's asking, comparing growth between lockdown versus non-lockdown countries, that's your graph, I guess, Dede. It's biased, especially when we want to know whether lockdown produces more severe economic impact. This is because countries already grow very differently, even before the lockdown. So you need to take that into account. We also need to compare the difference in growth rates, before and after the era. And I think this is a question which may have also come in from Professor Arif from UNPAD. I guess that's our friend Arif Yusuf Ansuri. So they're just a couple of questions that if you have time to comment, but feel free to move to general Q&A if you like. And since I'll exit the chair and hand over to Acho, Dede, thanks very much for a wonderful, wonderful Q&A. And as usual, you've done a fantastic job covering a lot of issues. Terima kasih banyak. And over to you, Dede, then perhaps to Acho.
Perhaps let me try to answer this question in general. Otherwise, probably we will not have time to, for other question. Let me take Rick's question regarding the investment. Yeah. The way I look at this situation is probably one of the lessons learned from this COVID is don't put all your eggs in one basket. Yeah. So I speculate there is a possibility of what I call the de-Chinafication, because China is accounted for about 20% of the global supply chain. It's too risky if you put everything in China. And it reminds me when I was a chairman of the investment board, 2011, 2012, yeah, there was a flood in Bangkok that prevent Toyota to produce their production network in Asia. And then Indonesia took the opportunity, you know, to ask to persuade Toyota to put Indonesia as the other production base besides Thailand. And then they did it, 2.7 billion US dollar, not because I was doing great, but because we were lucky. There was a sort of like quote unquote natural disaster. So I can imagine, yeah, from the investor perspective, they have to diversify the investment from China to other country. So I can see the opportunities for Indonesia to take this, you know, to take this investment. So they might come to Indonesia, but it depends again on the issue of this investment climate. Are we able to address the pandemic issue? So in my view is maybe if this will have impact probably about 2 years from now rather than next year, yeah. I'm not sure what is the Arif's question, or probably we can have a discussion later on, including Ross' question about the QE.
Yeah. I think I'll hand over to Acho now, if I may, Dede. And by the way, this question of portfolio diversification in trading partners is the topic du jour in Australia. As you may have seen, very sadly, our bilateral relationship with China is in quite a bit of trouble. But thanks again, Dede, and over to you, Acho.
Thank you, Hal. Well, I'd like to thank everyone again, all the 6 distinguished speakers. That's been a very good conversations. And I hope you can hear me clearly. It's just raining very heavily. I'll read some of the questions from the Q&A. And the first one, I think this is addressed to either Bu Titi or Pak Tikki. It's about the communication strategy of the government. So Yesi and Dadang were asking about the potentially communication problem. So are they too early in campaigning that vaccine when we have a vaccine will be in good situation, or maybe they just need to focus on strengthening, you know, the campaign on the what Bu Titi said, 3 M's, the mencuci tangan, menjaga jarak, memakai masker, wash the hands and keep the distance and put on your PPEs or masks. So that question was about the communication. And there's a question from Pak Adi Aman. Let me find it. Okay. So this is about Pilkada. So are the Pilkadas truly helpful in invigorating the economy, as the Minister of Home Affairs contends? Would postponing them to, say, June 2021 have made a difference in terms of supporting Indonesia's state of the economy? So whoever wants to address this. Also, I think Pak Budy, Hal, and also Liza, feel free to also comment if you like. So let me first turn to Ibu Titi to address these questions.
Thank you, Acho. Thank you for the questions. Yes, I think the communication strategy might need to improve, given that our country is so diverse, well, populous and archipelagic, yeah, and diverse means that not all can be reached by digital technology. So you have to reach them physically if you want to reach all the population. So I think the communication is quite challenging, but probably we need to also be a bit fair to the task force, that they have done a very good, the best that they can. Use all the media that they can have, TVs and several others. And also the local government has done quite a significant role also in tackling the issues. They have used a lot of strategies to communicate. But then again, as Pak Tikki and I already elaborated, that we have a huge challenges basically on the recipients side as well. But of course, the 3M still remain, yeah. So that is the main strategy currently, and it's going to be as valid as it is now when we have the vaccine. The three T, the testing, tracing, and treatment, yes, is still limited, but President has instructed to have it increased to 100,000. Currently, it's 30,000. PCR, we don't have any issues with the supply side on the PCR test because the import is quite easy, and it's also facilitated by the government. And domestically, it is also produced by Bio Farma. So given that we don't have any issues with the supply, it seems that in addition to PCR, we also have some innovation domestically on the rapid tests. So there are many antigen rapid tests available, but probably the issue is at the price. If you do it independently, not if you are not part of the tracing, means that you have to pay for your own testing. The current price is a bit still high for some people. So the government is trying to evaluate. I mean, the Ministry of Health is regularly evaluate whether the pricing can be reduced again. So on the vaccine, I think we have to try any means to handle this COVID-19. So if the vaccine available, please remember that the vaccines is not available for the whole people in this world. So I mean, in the short term, yeah, eventually it will be available for all people. So first, that you are right, that our frontliners, our healthcare people need to be protected. So this vaccine will be for them at the first place. So we have to cover all the healthcare people. So I think the government is trying their best to see any possibility to handle this COVID-19. Thank you, Acho.
Thank you, Titi. Pak Tikki, do you have a comment?
Yeah, just a quick answer. I don't believe it's a question of prioritizing one communication strategy over another. They are not mutually exclusive. So we must continue communication on the 3 M's, absolutely critical, as well as beginning to start communicating about the vaccine, because that's a bigger challenge. There's, as I mentioned before, a lot of misinformation, a lot of fake news, especially about the safety of the vaccine. Okay, so I think the communication strategy there has to be very vigorous to say a vaccine is a proven public health intervention, over many decades. Yes, at the same time acknowledge, because this vaccine has been developed very rapidly, that people are legitimately worried about safety issues. Okay, but we need to overcome that. And I think all those communication strategies around 3 M's, around vaccine, has to go together. Thank you.
Thank you, Pak Tikki. Pak Budy, do you want to comment on Pilkada?
Okay. To be honest, I'm not sure about the answer. Yeah. Okay. Because if you think that there will be a sort of like a positive implication, it's already happening, because Pilkada is probably next week or 2 weeks from now. Definitely, the campaign will have an impact on the economy, but I don't really see much an impact on this. Yeah, that's the first one. The second one is also the amount of money has been disbursed, probably relatively limited, because many people get affected by this. So the situation maybe will not be the same like what we had during the 2014 or 2019, during the general election. Yeah, so maybe I'm not really sure about this claim that this Pilkada will have this positive impact on the economy. If you ask me whether this will have an impact, the answer is yes. But whether this will be able to boost the economic growth, you know, then we will have this positive growth in the first quarter, I'm not really sure.
Thank you, Dede. Mas Budy, I had to put you on the hot seat, but I understand that you also have some studies about this, COVID and the economy. So I just would like to ask if you have comment on what should we really prioritize on, for example, next year.
Okay, so thank you, Acho, for the opportunity. I think one thing that I would like everyone to start thinking is that Indonesia is very diverse. And so thinking about one policy that fit all will be a bit difficult. And second is that, however, the difficulties is that if you let all region making their own policy, you do not have a coordinated policy. So that is one thing that need to be considered. For example, the worry about a bit stricter lockdown or a bit stricter movement of people is probably valid for the impact probably quite very strong in an economy such as Java. But I was a bit surprised when that kind of thinking also applied to, for example, Papua, in which we know that the economy, a lot of things happening in Papuan economy, but there are two things that are important. One is their mining activities, which is those are organized by big companies, so they know how to handle movement of people within them. And second is government transfer. So that the two main driver of Papuan economy. And so basically lockdown in those areas got very different impact if you do lockdown in Java. And that is the one that I thought is not realized quite a lot by the government. So actually, in my opinion, lockdown in remote region like Papua, Maluku, and NTT would be kind of better option. And second, there's another thing also that health facilities in Indonesia are very different. And so the problem, if you have a health problem in Java, you probably could, recover. But if you have a health problem in remote area, they become an endemic over there. So let's give an example of AIDS. For AIDS relatively come very late in Papua. It just come in Papua at the end of 1990s comparing to other places. But then it become an endemic over there. It's very difficult to trace, it's very difficult because the health facility is not there. So looking at Indonesia, don't just think about what's going on in Java. Things are very different across Indonesia. So that is, I think, the one thing that I would like to mention, what policy that need to be conducted in the next year. And then the other thing is also another example that I would like to mention is, I think I would be a bit disappointed or I will question the strategy of whether it's better to deny the possibility of the spread of COVID rather than accept there is a big possibility of spread in COVID. That's also what kind of communication strategy that you apply within Java and outside Java could be different. I think probably, in some area, it's just better, we admitted that there is a high probability that this COVID will spread up in your area, so you better guard your area better. Now, there are some issue on, for example, security issue and so on, so you might want to do that. So I guess the challenge for Indonesia is that having this diversity among regions, what is it the right strategy in informing policy? One type of policy could not be work well, but letting others make their own policy, it might not work well as well. So within those things is where we need to play around. Thank you.
Thank you very much, Mas Budy. I see one hand raised, and that belongs to Peter War. Peter? Yes, go ahead, Peter.
Me.
Yep.
Right. I have a question for Dede, but I just like to remind you, Aceh, that Arif Yusuf has a question that hasn't been read out yet. So please, let's get to that. I'm keen to hear what Arif wants to ask. So here's my question. It's for Dede. Is Dede still with us?
Yes.
So my question is, Dede, your presentation was fantastic. There was just one aspect of it that confused me. When you showed the lockdowns and the growth rates, I wasn't show that diagram. I wasn't sure what you were saying. What's causing what? I can imagine. So it's the difference between correlation and causation. That's the essence of my question. One possible interpretation is that lockdowns cause you to be more severely affected economically. And another interpretation is those countries that are most affected by COVID-19 suffer a big contraction in economic growth, and also they are the ones, because of the greater incidence of the infection, feel obliged to lock down. So in that case, neither lockdowns cause low growth or low growth cause lockdowns. What is your point?
Thank you, Peter. Before I give the floor to Dede, I'll just clarify about Arif Yusuf's question. As I understand it, it was question from Riandi, who quoted Arif Yusuf. So Riandi was asking about, is it fair to compare two countries while one is using lockdown, the other is not using lockdown? Is it fair to compare the growth rate between these countries? And he was quoting Arif Yusuf also about this, view. So that's okay. Thank you. So over to Dede maybe to comment on this question.
I completely agree with you both. Riandi.
Riandi, yes.
Riandi and also Peter. That is why Peter has said that we probably need to wait for more data because we need to do a rigorous study related to that. But my slide is just a sort of like immediate response to Hal, looking at this current situation, because there are so many things that we don't really know at this moment. Yeah, just looking for the data, Vietnam is doing relatively well. They introduced lockdown, but for the short period of time. China also had the similar pattern. Yeah. But in the case of a country like Indonesia or South Korea, we don't really introduce the strict lockdown. The economic activities is still there. And I agree about this correlation rather than causation. We probably need to sort of like, to do a more rigorous study related to that. But talking about the case of Indonesia, it is very clear, Peter, that after the reopening, after the reopening on June, all the leading economic indicators improve. Yeah, and then this is consistent. All the Google Mobility Index, the electricity consumption, the Purchasing Manager Index, the retail sales, etc., improve after the government reopened the economy. And you could also see that the Indonesian economy turned around after in the third quarter for two reasons. Maybe because the reopening, and also maybe because the impact of the fiscal stimulus. But one thing that I can share with you, and I'm quite pretty sure for this lockdown is biased toward upper and middle income group, because unlike in Australia, we don't have DOL. Only the rich people could afford to be unemployed in Indonesia. Yeah. If you are poor, you stay at home, you don't have any income, you're gonna die. It's too poor to be unemployed. So if you want to introduce lockdown, you need to get a support from the government, like the cash transfer. So, and then you can see the one who spend the money is the poor people. Yeah. So I think I agree that would be at this moment, will be very difficult to make a conclusion, because we probably need to do a robust study. And then this is really a big topic now all over the world, the debate between the impact of the lockdown to the economy. Yeah.
Right, thanks, Joe. May I ask a follow-up question, please, Acho?
Sure.
The follow-up question, your answer there brings out the point that the social protection is really very crucial here.
Correct.
And so my question is there a difference between urban areas and rural areas in the degree to which they can benefit from the social protection measures? Or is it biased towards urban areas? I really don't know, so I'm just asking about that. I can see it's very important.
Yeah, I agree, Peter. This is a very good question. Again, this is again my speculation. Yeah, I do believe there is a difference between the urban area and the rural area. That is why the reason why I said this is the lesson learned from the 1998. Yeah, during the 1998 and the Asian financial crisis, because the government HANA, one of our proposal, yeah, related to the COVID, is to focus on the urban area first to prevent people to, going home to the rural area, because once they are in the rural area, that's exactly what Budy mentioned. The health facility is bad and we cannot really control. So I cannot answer your question, Peter, but I do believe there will be a sort of like a different pattern about the social protection in the urban and the rural area, because in the rural area they have this support from the family, etc. Yeah, but again, this is a very important issue need to be studied further.
And that might also matter when it comes to vaccine distribution, if we have it next year, say, for example, right? Because the urban areas, they are better prepared in terms of technology, and all these vaccine, for example, they require very like cold storage, minus 70 degrees, for example. So and you don't have it in rural areas. But thank you, Dede and Peter. We have 3 minutes left, but I'd like to invite Liza. Maybe she has some comment if as a follow-up to what Pak Tikki and Pak Titik has mentioned. So go ahead, Liza.
Thank you, Acho. So I just would like to add on to this question regarding communication that Tikki and Budy already mentioned. I think one thing that could be highlighted as well is in terms of stigma. We have these campaigns on 3M, 3T. This is very important, but the issue of stigma, I think, is quite a big hurdle at the moment, specifically in terms of testing and tracing. So that I'm not a communication expert, but I think the government might, benefit from working with communication experts to deal with that, and then also working with the media so that the media would support, all these campaigns that are in place, all the good government policies there. And in terms of vaccines, I think it's interesting that each country, it's a global pandemic, but each country has now found itself in a spot where it's different from one country to the other. Some countries have managed community transmission very well, some haven't. And so we're looking at some countries introducing vaccines a bit earlier using emergency use authorization. Some are willing to wait when community transmission is not there. So we always knew it was a 12, 18-month wait, which is very remarkable for vaccine development. But we have to keep in mind that, Indonesia has a situation where it might not be seeing policies that would necessarily, be implemented in that country as well.
Arianto, if I could just add quickly
sure.
to what Liza said. No, sure. Absolutely, stigmatization is one issue. But for me, one of the key issues on communication, especially on the part of government, is transparency, accountability, speed on sharing of data, which is evidence-based. Thank you.
Thank you, Pak Tikki. Hal, we haven't heard from you in the last 2-3 minutes. So do you have any additional comment, Hal?
Well, could I ask something totally left field?
Go ahead.
Please mute me if you want to. It's so completely unrelated to the question we're talking about. But this is, Dede, Mafia, I want to put you on the spot, kalau boleh, and also if you want Titik and Tikki. How is Indonesia viewing the Biden presidency? And you can mute me if you like, Acho. I know it's not to do with the topic today.
Dede, you want to? Yeah, yes, sure.
I don't think there will be a significant change of the U.S. policy towards Indonesia, Al, because talking about the U.S. and Indonesia, this has to do with the tension between China and the U.S. Exactly. And I think about the China issue, both Democrat and Republican are bipartisan related to that, because the issue is beyond trade. This is about a rivalry between the rising power and established power, the Thucydides trap. So I don't think that there will be except maybe Biden will be more stable rather than erratic Trump related to the trade policy, but the tension will continue, and this will have an impact on the geopolitics in the Southeast Asia as well. So maybe still very difficult to expect that, Indonesia's trade, for example, will be improved very significantly because the tension between the US and China. Yeah, so I don't see much different in terms of this policy impact on Indonesia, but I would say that maybe Biden would be more predictable rather than Trump.
Mm.
Yes, I mean, from my perspective, I just have two hopes for the Biden administration. First, that the US rejoins the WHO. Exactly. And secondly, that the whole toxic atmosphere of denying science and evidence will disappear. Yeah. Thank you.
Here, Tikki. They're both so important, aren't they?
Thank you so much. On that note, we have to close this session. Once again, it's been very wonderful sets of conversations. So I thank again all of you from Liza, Hal Hill, Chatib Basri, Budy Resosudarmo, Tikki Pangestu, and also Titik Anas. Thanks again, and also for all the attendants. I apologize for those whose questions were not answered at this moment. And I think we'll meet again early next year. Is that right, Nuka? I just give this over to you, Nuka, to close it. So go ahead, Nuka.
Thank you. Thanks, everyone. Yes, we will see you again next year, hopefully at the end of January or early February. Hopefully, and please stay healthy, everyone. And thank you again for your participation for a whole year. This is our 26th seminar, by the way. The first one was with Bang Dede back in March.
Yeah, some of them are returning speakers. So thanks again, Dede, Titi, Mas Budy, Hal, and also, of course, thanks also to Liza and Tikki. I hope this is not the last time.
Thanks again to Acho, Nuk, and Dori for doing a wonderful, wonderful service all year. It's been great.
Thank you.
Thank you,
everybody.
Thank you. Thank you, everyone.
Thank you so much, everyone.
You can now have your coffee, Tikki.
Yeah.
Morning coffee.
And my breakfast, yes.
Thanks.
Goodbye. Thank you.
Bye, everyone.
Bye, thank you.
Thank you very much.
Bye-bye.
Bye.